Good afternoon, ESSM. On behalf of Rigicon, I just wanted to thank all contributors and to take this opportunity to thank all participants, specifically for taking the time out of their busy schedules to make themselves available for this symposium this afternoon. Ridgicon has been busily manufacturing a portfolio that is highly competitive and unique in the men's health space. They've been doing this for about the last 10 years, currently manufacturing in Long Island, New York, where our manufacturing facility is based. We are creating consistently a highly innovative portfolio, and both with the current offering, we continue to bring highly innovative new products to market and will do regularly. Our portfolio currently consists of a malleable semi-rigid implant, a three-piece standard, a narrow base, and also an anatomical expansion range. We also have an artificial urinary sphincter. In addition, we have a full range of testicular implants, both saline filled and firm. We also have a complete range of both single-use and reusable instruments to facilitate surgery in the men's health space. And I'm delighted to be able to communicate to you that we are the first manufacturer to be able to launch a unique single-use furlough. I would like to say a special thanks to our faculty. First of all is Dr. Osmanoff from Kiel. We have Dr. Raheb from Cairo, Dr. Alhona from Madrid, and last but not least, Dr. Kramer from Cape Cod. All of these surgeons have worked tirelessly to deliver a phenomenal set of videos for this symposium this afternoon. So thank you all very, very much for this. I wish you all a very enjoyable symposium. Should any of you require more information on the Rigicon portfolio, please do not hesitate to contact us on www.rigicon.com. Thank you.
Hi, this is Andrew Kramer. I'm here to share with you a presentation at the ESSM. Thank you so much for the invitation. Let me talk about something that I've learned about just the last few months to year, and it's going to be about the Rigicon penile implant. What we have is a new implant. We've got some new surgical techniques. We got some new tools. The title is more rigidity, less cylinder aneurysm. I think that's true, but I think there's many other things to share within this presentation. Just out of my background, I'm known, I guess, for making videos and having transparency with patients, but more than that, I think I look at my surgeons. I heard that Patrick Walsh at Hopkins studied years of radical prostatectomies, and I learned how to get better at them. I try to do the same, but I also reflect on things that I'm doing, not just sort of doing them without thinking about it. So let's talk about the need and what got us here. In the past, and look, the first implant was done in 1973. I know that. It's the year I was born. But what do we have now is a lot. Coated and dipped devices, palpable pumps with gripping ability, anatomic tips for the cylinders based on cadaveric casts. We have one-touch release pumps, and auto-inflation has been eliminated with lockouts in the button or pump, in the pump or the reservoir. These are huge things, but there's nothing wrong with adding things to that and adding a new hybrid. But the world has always been in this tug of war, and I understand why. Is the implant too soft, but it's good in the natural state? Is it too hard, but it has crinkles? It's too hard. It's too soft or it's too hard, because nothing's been the perfect implant for both situations. You can imagine how it'd be kind of hard to do that unless something new came along, because all we have is the same anatomic spaces. I mean, we only have cylinder, corpora, reservoir, pump space. I mean, that's all you're working with. You can't really make a quantum leap yet, but you can update things. Other considerations, when you do an implant, and like me, a lot of revisions, is it good for priapism? Is it good for infections? How about revisions? Because the implant, you can't design it just for the virgin patient with easy anatomy. If you have a practice like mine, you're going to have to think about the tough cases, and that's so important. For me, here's cases that I get: priapism and corporal fibrosis, infections, devastating. So what is going to work? I'm going to say Rigicon is like a new update for your computer. Things are going to be similar, but they're going to run a little better. There's going to be some new improved things. You're going to have a couple new tools and bells and whistles. So let me talk about how Rigicon is like a new update for this world of prosthetics that sort of moves at a slow but steady pace. This is going to be a lot of new things, a lot of new improvements. This is going to be an upgrade. Let me tell you what we're doing here. I call this a hybrid. And what I mean is you're going to take the things from the AMS and from the Titan, try to see what works well, because these companies have great implants. What works well? What can we use? And what can we add to? There's nothing wrong with that. You're trying to use everything great out there, and these companies have amazing implants. Can we take the best of both? Can we add a few things? That's the spirit of that Rigicon 3-piece inflatable. This is what it looks like in real life. Let me tell you about a few things. The Reservoir. The Reservoir to me is the least important thing, because once it's in, the patient has no interaction with it. It's just in. The best Reservoir is the one the patient doesn't know about. But for the surgeon, we want to be able to get that in and accomplish our goals. This one is sort of like the Titan with the anti-lockout in the Reservoir. What that means to me is there's no anti-lockout in the pump, complicating something so elegant. The pump is so tricky and important. Do you really want to complicate that with a lockout? So this is in the Reservoir. It's hydrophilic, so it's slippery. You could slide it all around. As far as I know, that's the first really slippery, slidey Reservoir. And it's favorable in shape, as you can see, to get into those pelvic or ectopic spaces. I don't really use them, but you've got to be prepared for that. So next, the cylinders. We're getting closer to the more important stuff. These studies, the one from my mentor, Irwin Goldstein, they've been going on for years. What is the column strength? How much weight can it hold? Does it have a soft state? Does it have a hard state? It's important, but here's the cylinder. So it's got the tip that looks anatomic, according to those recent studies by Dr. Carrion. It fits appropriately, but there's the big, it's slippery. A slippery cylinder is so important because you can slide it in, get those tips up, easier to place it. If you put in a cylinder, it's not hydrophilic and slippery. It's just harder. It grips the tissues more. This is slippery. However, it's also got that reinforced layer. It's got these 4 layers, so it feels soft, but when you pump it, those 4 layers sort of turn into a hard, thick layer. So I'd say it is a good approach at natural, like an AMS, maybe not as soft, but it's hydrophilic coated, it's slick, and it is as firm and thick as a Titan. So you've got a tremendous upgrade here. And plus the rear tips, I'll show you, they really click hard on there. So if you're in and out with a cylinder, so you get an infection, you want to change the size, you don't lose your rear tip every so often trying to pull it out and push it in. It grips that thing for life. But it's got that 4th layer. Look at this. It's like the layers of an onion, like you see with that AMS, but it's got soft mesh, it's got hard, it's got another hard. And so you've got that mesh work to keep it soft, less aneurysms because you've got that reinforced sheath. You'd have to have an aneurysm of all 4 layers, or I mean, it's very unlikely to get that. But look how thick the layers become when you get to the outer layers. That outer one that looks sort of clear is a very thick layer that doesn't really become hard and thick until you pump it all the way up. So what's important about this? When you do revisions, you need slippery to get that tip all the way up. You need all the tools. I mean, you need the soft state to get into that scarred corpora, but you need the hard state to get all the way up into the glands and stay there. You're going to have cases like this, revisions. And here's one that I did. Look at that right. I mean, the right image. This, I mean, you know, believe your own eyes. This is thick. I mean, it's not bulging out. There's no sort of inability to keep the cylinder in. When you pump it, it almost looks anatomically too thick almost, which is great. I mean, it looks beyond thick. How about cases like this when the tips aren't all the way up? Well, I see these a lot. Maybe the surgeon was too conservative. Maybe there was scarring. But it's easy when you've got a thick tip like that. You've got a thick cylinder to get it in, it's slippery, and then you can pop the tip all the way up. If you don't have that rigid, like that Coloplast has it too, you can push the furlough and pull it all the way up. Unless it's rigid enough to plow through the tissues, it's hard to get tips up. Here's what we have here. We've got that sort of CX, LGX design here. Here we have what's going to be called the AX and AX. So here we have the Infla X, which is like the CX. That is girth enhancement in every case, by the way, every case. The AX is comparable to the LGX. It will expand in length and girth. So you've got the choice there. You always have girth enhancement and stretching. And if you saw the other picture when I pumped it up, it was thick. I mean, it's just so thick. And if you like that stretchiness, maybe due to patient request, maybe you can sort of be short of the glands. It'll work its way up. That's the theory of the LGX. Well, here's the AX. So that entity is here as well. That's a cylinder thing. And let's talk about pumps. I think the pump is the single most transformative thing about this implant in my experience. The biggest thing is it is so easy to squeeze. It's always hard talking to patients and getting them to learn the pump because it's easy outside the body and it's easy for surgeons. But it's hard for patients and it's in the body. It's always harder than you think. They always see that model in the office and they say, "Doc, it never worked out as easily." Well, this one is. When you squeeze it, it is as soft as a little piece of gum, for example. It is almost just like that feeling of memory foam. You squeeze it, it's just squishy. Very easy to squeeze. There is no pop. There's no distinctive click to get the thing going, which is the source, I think, of all trouble for patients. So no click over, no hard pop. Deflate is a button, almost like an AMS, but easy because you don't wait for that click or pop. You just squeeze it once, let go, and it goes. So two things that require almost no force at all. The squeeze to get it going is just like almost like air. It is so soft. And the deflate is so soft. So this is an important thing. Here we have tactile, we've got button. That's great. Here we have that easy burst. And you don't really have the pop over unless you do the one touch. Well, here we're going to have no pop. We got that round, easy design to just get that over into inflate mode, but it takes almost no force at all. Just the lightest squeeze of your fingers to get it going, and you've got the button. So here's what you have. Very easy to compress, very easy to inflate, very easy to deflate. No glitches, no pops, no huge force to get it going. And let me talk about some new tools before we wrap up. Tools are the lifeblood of really any surgeon, I think. And what do we have? We've got two things here. We've got the disposable or one-use furlough inserter, and we've got this reusable dilator. Let me go into more detail here for a moment. This is called the HL dilator. It's got the tip, which is known as a olive tip, I learned, where it's got the sort of three angles to it, almost like a triangulated tip. And it's got 10 on one side, 12 on the other. So you can go from 10, you go to 12 with one instrument. It's got markings on both sides, which is incredible because when you go down and dilate, if you use the small end, well, you can flip it one way or the other. So the numbers are always going up on one side, down on the other. So it's one tool, there's no flipping. It saves two big steps. So one tool goes 8 to 10, but also you don't need to go out and say, "Oh, I went, the numbers are going the wrong way here." No, the numbers are always coordinated and you can always use one tool for up and down. To me, was this I said with the implants, we're not saying, "Oh, there's no use of any other implant." I will say for this, there's no use for any other dilator. Once I used it, I made videos. People were calling me nonstop and saying, "I want to buy that thing." Is it dramatically different? It is. This dilator is very good. And I like this angulation. I never liked the L shape or other things. So I like it. And let's get into these. There's another tool. We've got the semi-rigid. I would say, without getting into this too much, it's like a hybrid again, but it's more like the Tactura from Boston Sci. But it's got more sizes, 9, 10, 11, 12, 13, 14. So more sizes available and a nice dipped semi-rigid. I've used this many times. And here is that one time. And it is the world's first. It's a new invention. The world's not seen this, which is pretty incredible when you think about it. It's a disposable. Remember, that hole in the reusable furlough is always that most sensitive sort of weak spot in your infection control. You do not know what's in there. You got to clean it with a laser pointer and a brush, I learned. So you don't have to worry about that. If you're worried about infections and you're like me, you're looking for the source, you're trying to blame something, you take the biggest culprit out of the equation with this one-use single furlough. I think it works almost every time. It's not as hard or heavy duty as the metal furlough, but I think if you push hard enough, you can definitely, if you do your dilation good enough, you can easily get this up to mid glands, and You use it, you throw it out. I like it. It's the first of its kind. Again, is it going to replace everything? No, it's a tool. And tools are why we're studying, we're academic, and we're trying to teach people. More tools is more options. Again, you've got cylinders with new ingredients. You've got Reservoir, new things. By the way, hydrophilic is a big option, or a big benefit these days. You can dip it in whatever you want, because people now are questioning, what do you dip it in? Do you add an antifungal? Do you want to replicate just the sort of, rifampin tetracycline? Can you add other things? And can we do this DNA testing, these, multi-generational, it's called these. So you can do all sorts of things with infection control. So let me wrap up here on the last slide and say that we've got some new tools out here. We've got pumps that are drastically easier to use. And let me wrap up by saying this. I've used this now. And let me tell you what I've learned from it. Here's what I think is the benefit of it, which I think is tremendous when you add up these things. My experience has shown that the pump is the easiest thing to squeeze, and there's no pop. Teaching patients is suddenly this aha sort of situation where they're like, I can squeeze it. I can squeeze it. So this is a big breakthrough, and the button is easy to squeeze, easy to get into. There's no difficult popping and glitching. So I like that. The cylinders are a big breakthrough. You've got that 4-layer meshwork, the heavy-duty feel to it. It still feels soft. When you pump it, it is thick and hard and less prone to aneurysms because of the extra layer. The Reservoir, again, little upgrade there, but together you've got a lot of things to think about with those new tools, and the 3-piece implant, to me, has been extremely successful. And those tools and the olive-shaped dilator and the furlough, I've enjoyed using them as well. You got to have tools, and you got to try new things if you're going to push that needle forward. Thank you so much.
www.mypelvichealth.co.uk